All right, can you all see my screen? Good. All right, so let's talk this afternoon about infection prevention, specifically for home care segment. Um, so, the idea is actually to today is really to talk about surface hygiene and to let you understand why it's so important, especially those days. And so, as you know, especially in that particular context of COVID, you need to really understand how COVID actually spread and how we can stop it. And this is a good example because that's actually is probably the best example of the importance of infection control as a whole. And you need to understand firstly how it does spread and what needs to be done to tackle it. Um, so you can see that once a patient or anyone is actually coughing or sneezing, you will emit actually, even by breathing or even speaking, you're going to actually emit some droplets. And those droplets will basically contaminate your hands or your direct surfaces. Any shared equipment, any surface that you may touch can actually become contaminated. And so those surfaces would actually become a reservoir of viruses, okay? And you need to actually perform a good hygiene, not only for hands, but also on surfaces to make sure that you can actually reduce the risk of cross-contamination, whether to the next patient or to the relative, right? So what you need to understand is that what can we do about that? We can, of course, use PPE, so mask and gloves. We can, of course, and it's recommended to wash and sanitize your hands, but it's also recommended to regularly clean and disinfect what we call high touch surfaces. High touch surfaces are basically surfaces you're gonna touch on regular basis, okay? It could be shared equipment, like medical equipment, but it can be any surface within your home that you're gonna touch on regular basis. So this is COVID, but what you need to understand is a lot of bacteria, viruses, can actually survive for an extended period of time. And so in reds, as you can see, you can have MRSA, VRE, norovirus. So it's a blend of bacteria, but also viruses that can survive from 7 days to several months on a dry surface. And today in community, and especially in home care, apart from COVID, you need to understand that there's a lot of issues today, and the highest risk is related to what we call multi-resistant germs, which are actually those germs which are resistant to antibiotics. And MRSA is actually one of the most popular one. And it's a real problem that needs to be tackled. And you can see that MRSA on a dry and clean surface can still survive for several months, up to 1 year. So that's why it's very important to actually consider surfaces as a reservoir of germs. So when you look at the guidelines globally, and this one is from Australia, but actually we have also guidelines from Europe, from US, from Singapore, it's all the same. Whether you talk about healthcare settings, home care, you need basically to clean and disinfect surfaces in regular basis. The problem is, and that's very true in the community, people don't really understand or realize firstly the importance of cleaning, and secondly, they don't really understand the difference between what is a detergent and what is a disinfectant, okay? So I would like to let you understand what are the differences, because that's very important to understand basically the benefits of a detergent versus a disinfectant. So when we talk about detergents, so household detergents, basically, detergents will basically remove organic soil from a surface. So basically, you're gonna remove the soil from the surface, but the detergent will not be able to kill bacteria or kill viruses. It will only be able to actually remove from the surface, but basically transfer those germs or viruses to another place. And that's the difference with a disinfectant. A disinfectant will actually inactivate or kill the germs, okay? The problem of disinfection is that it needs to be done on a dry and clean surface. Okay, a disinfectant will perform in a pre-clean surface. And then you need to respect contact time, and you need to respect also the right concentration. Okay, so you understand the difference between detergent and disinfectant. What you need to understand is viruses or bacteria are actually extremely sticky on the surface. And so the recommendation is actually to use a detergent to clean the surface and the disinfectant to kill those bacteria. And so that's why comes the concept of two-in-one cleaning. So historically, a lot of people were using a detergent to clean and then a disinfectant to disinfect. So basically they were using a detergent for cleaning and then, for example, using alcohol for disinfection. So this is what we call a two-steps protocol. The problem of a two-steps protocol is that it's a two steps. So you need actually takes time. And secondly, people most of the time do not respect those two steps. They will tend to use alcohol straight away for quick disinfection without pre-cleaning the surface. And so today on the market, and we are one of the company to provide such solutions, you have products that combine cleaning, so detergent properties combined with disinfecting properties. And so we have, for example, wet wipes that combines cleaning capabilities with disinfecting properties, which mean that in one single step, in one application, you will actually clean and disinfect the high touch surfaces. So that really simplified the protocol compared to the detergent plus disinfectant. Okay, so from a two steps, you can today have solutions that actually can provide a one-step protocol. So what is this two-in-one cleaning? Is basically, you need to understand it's the concept about two-in-one is basically when it's really like you vacuum the floor. Before vacuuming the floor, you need to actually remove cloths, right, from the carpet. And so the same rules apply really when you disinfect a surface. You need to clean and disinfect. And so the fact that we have a product that combines cleaning and disinfecting properties will allow you to do this double step in just one single application. You need to know, and this is the next couple slides, you need to know that a lot of disinfectants can be inactivated by organic soil. So organic soil, I can mean, for example, blood, body fluids, so spills. And so you need to really, really be careful in selecting the right products that have a proven efficiency in dirty conditions, because that will actually provide you the real efficacy in real condition of the product. So how to choose the right surface wipes? So when you look at the guidelines in Singapore, dated 2017, you have a list of criteria, parameters that are important in selecting the disinfectants. And actually, when it comes to home care, actually I would prioritize three criteria. The first one is efficacy. So you need to understand the difference between what we call a consumer product and a medical grade product. A consumer product will kill only 99% or 99.9% of those bacterial viruses. This is what we call a consumer or household product. A medical grade product is actually a product that will kill 99.999%. So it's 5 log reduction of bacterial viruses. So there's a big difference in terms of efficacy between a consumer product and a medical grade product. And when we talk about home care, the idea of home care is actually to protect the patients and their relatives from MRSA, from norovirus, from all those bugs that you can actually get also from the hospitals. So you really need a high efficiency, and it's highly recommended to have a medical grade product. Okay, so that's the first thing. Efficacy is very important. The second is contact time, and you need to understand that between products, between disinfectants, you may have very different contact times. Contact time is basically the need, it's actually the time that the product we need to kill or inactivate the virus. And you have products on the market that will claim 5 minutes contact time, 10 minutes contact time. This is not realistic. You need products that will actually inactivate bacterial viruses in maximum 1 to 2 minutes contact time. This is the time for the disinfectant to dry on the surface. Okay, if you have a product that claims 10 minutes contact time, it means that the surface needs to remain wet for 10 minutes, which is not the case, because when you use alcohol, the surface will dry immediately. And so it's not enough time for the alcohol to inactivate the virus. So 1 to 2 minutes is basically the recommended time to let the surface dry and then to have a full efficacy. And then the third one, of course, in my opinion, is clearly safety. Safety in terms of toxicity, product that are not perfume, product that does not contain alcohol. This is very important because in home care, it's much more difficult. People in home care are less professional than in healthcare workers, right? So they need to have products that are much more safe in a way, easy to handle and safer for them and their relatives. So it's about safety, about inhalation, it's safety about also contact tests like dermatological tests, which are actually safe for hands or for skin, right? So safety is very important, especially safety at home, because those products in home care are not always used by professionals. Okay? So efficacy, contact time, and safety. And we've done in the company, we have, we are market leader in Europe and in a few countries globally. So UK, clearly, we are one of the major player in the UK and Australia. So we have a very, very big market share in acute, so in hospital market. And we are actually selling our products now in ILTC, home care, through retails or directly into the market. And the good thing is that we've done, because we have a very solid base of healthcare workers using our products on a daily basis, we've done actually a survey, conducted over 500 nurses in the UK, and said that 76% of the nurses would actually use our products to protect themselves and their families at home. So that's a very good indication that our products, which are widely used in hospital, are highly recommended by healthcare professionals to be used in a home, actually. So 5 principles of cleaning. So this is about protocol, and just to let you understand how it is important to respect those protocols. So the first thing is, when you use a wipe or a cloth, you need actually to wipe the surface in a S shape. Okay, so that's the principle number 1, because the S shape pattern will actually allow you to cover the whole surface of your equipment or device. The second one is always to work from top to bottom. Why from top to bottom? Because you need to get from the most clean part to the dirtiest part. And most of the time in your equipment, the dirtiest parts are on the bottom of the device or the surface. Number 3 is wipe to clean, from clean to dirty. So if you have splashes or spills in one corner, you always need to start from the clean side and finish by the dirty side. Because if you do the opposite way, you will actually push the dirt into the clean side. So that's very important to respect that step. Leave to air dry. And so as I told you, efficacy is very important. Contact time is very important. And then you leave the surface to air dry, and within 1 to 2 minutes, the surface will be dry and you will complete your efficacy, your spectrum of efficacy. And then of course you need to dispose. So that's the 5 principles of cleaning for a good usage of surface wiping. So what do you need to clean? What do you need to disinfect on regular basis? So of course, when you are in home care, you can divide, I would say, surfaces in two categories. You have what we call share equipment or medical device. So that's basically thermometers. That's actually the healthcare professional could bring to your home. And so this definitely needs to be disinfected in between patients, clearly. So that's what we call share equipment. And then you have another category of surfaces, which is called frequently touched surfaces, which are actually the home surfaces, which are frequently touched. And so we talk about desk, tables, door handles, chair armrests, light switches, handrails, and any shared equipment like computers, for example. And then don't forget food areas and bathroom that needs to be cleaned and disinfected on a regular basis. And then you dispose the wipe into the bin. And then of course, we do recommend to perform a hand hygiene after cleaning and disinfection. All right, so I'm done for this presentation. So if you have any question, I think we have a couple of minutes, or we could actually have, at the end of the session, we could have a Q&A session.
Yeah, I mean, I think we can let Michael jump in, and we can just maybe continue with the presentation. And at any time, if you, for participants, you can just type in your questions in the message chat function, and we can see the questions. All right, Michael, over to you.
Sure, thanks, Vanessa. So let me share my screen. Let me know if you can see my screen.
Yep, that's good.
Okay, a very good afternoon, everyone. Thanks, Vanessa, for the warm introduction. Together with Jiawei, we come from IDS Medical Systems. We are a medical distributor in Singapore. Ecolab and Gamma Healthcare, which Romain is from, and Ecolab are two of the brands that we represent. So today I'm going to talk about hand hygiene in a home care setting. As we know, our hands are our first line of defense, right? A lot of infection starts with hand. Therefore, it's really important to use a good hand hygiene product to build our first line of protection. And it's our belief that a good hand hygiene product should not only keep your hands clean visually, but also microbially. Because of COVID, we start to develop better hand hygiene practice. And we also have the habit of carrying a bottle of hand hygiene products with us wherever we go. According to the WHO, clinically, it's proven that by practicing good hand hygiene, the risk of urinary tract infection and the risk of a lower respiratory tract infection will be reduced significantly. So by just doing simple hand hygiene, we can lower the risk of having critical infections. Okay, there are two types of techniques that we engage daily to clean our hands. One is hand wash, the other one is hand rub. Earlier, Romain talked about the difference between detergent and a disinfectant. So the similar principle applies here. When we do hand wash, use either water or soap, where we are basically cleaning our hands and keep our hands visually clean, right? By practicing hand rub or hand disinfection, we are eliminating the microorganisms that live on our hands. So simply put, hand wash is for low-level disinfection. Let me just pull out the pointer. Okay, simply put, hand wash is for low-level disinfection, which we practice since we practice multiple times a day. And the hand rub is for hand disinfection, with the aim to reduce or eliminate microorganisms that live on our hands. Okay, every one of us practice hand hygiene, I think, differently, right? It's important that we do it the right way. I'm going to show you a short video later on to show you when we don't practice hand hygiene or when we don't rub hands properly, what will happen, right? On this picture, you can see that the areas like under the nail, at the back of our hands, right, thumbs, these are areas that we typically don't rub enough, right? And because of that, the microorganism cannot be completely removed or killed through the hand rubbing motion. So important that we do the 30 seconds of hand rubbing right. So now let me just play this quick video. Show the technique of 7 steps hand hygiene. We need to rub the back of our hands, which we usually don't. Between fingers. And this is the important part, fingers, to keep our fingernails clean. One more step, clean the thumbs. Last but not least, around the wrist area. Right. So we keep doing the hand rubbing motion for about 30 seconds until our hands are dry. That's when the hands are considered microbially clean. The next topic of my short sharing is about choosing the right hand hygiene product. Because of, again, the pandemic, we practice hand hygiene more often than we used to. Therefore, it's important that we use the right product. A good hand hygiene product should provide the level of protection from a microbiological perspective. At the same time, because of its chemical composition, it should also not cause any skin irritation to our hands. Especially we know that the skin irritation or dermatitis can be very irritating in our daily life once developed. Right? So we recommend a hand hygiene product that has no smell, as in no fragrance, non-sticky, and hypoallergenic. Some of you may have experienced in the past, right, hand irritation because of use of hand hygiene product or repeated use of hand hygiene product that contains chlorhexidine and iodine. Right? These are the compositions that we exclude from the formulation of a good hand hygiene solution. And to keep our hands moist, right, it's also important to look out for moisturizing agent in the hand hygiene product that you purchase. Right? Ideally, the hand hygiene product should have no color nor fragrance, okay? Because these are all additive, which may cause adverse impact on your hands. In terms of microbiological property, it's important that we choose a product can kill a wide spectrum of microorganisms, namely bacteria, fungi, and we, as I shared earlier, use an ethanol-based product that has no, or rather less smell, has good tolerance on skin and will not cause irritation to our respiratory system. Yeah. So Anus gel is one product that we typically recommend to our clients. And then now we would like to take this opportunity to share this product with you. Okay, that's all. End of my session. Thank you.
Thanks, Michael. So I think actually that was quite a good sharing so far, summarizing what Romain and Michael have shared. Firstly, about surface cleaning, which we see so many times for our customers and their families having to deal with, things like commodes, wheelchair surfaces, in a bathroom, and also even on the bed, bed rails, the bed surface and all that. So I think the surface cleaning is very important, and also for the hand rub when they're going out. I think now we'll invite Kiawe to just add on to that, sharing with us about maybe what makes a good antiviral face mask and what's the difference. So Kiawe, over to you.
Yep, thanks Vanessa. Can everyone hear me? Yeah, great. Thanks, good afternoon everyone. Let me share my screen. Can you all see my screen?
Yes.
Okay, great, thanks. So I think thanks to Roman and Michael, really makes my last presentation of this afternoon so much more easier. So today, hi everyone, I'm Kiawe. So yeah, let me share my screen. Okay, I'm Kiawe. So this last topic is about the mask, surgical mask. This is our house brand. It's called RespoCare. And really, if you hear what Roman and Micah has said, right? Actually, all our products is actually widely used in the acute hospital setting, so it's a really medical product. So our slogan has always been like protecting you with size. Yeah. So you heard about surface cleaning, you heard about hand hygiene. So now let's talk about mask. So our mask, right? Surgical mask. This is an antiviral mask. So thanks to Roman's explanation, he talks about log reduction. So this mask, right, compared to a lot of commercial available products, right, it's definitely a medical product. You destroy 99.99%. It's 4 logs reduction of coronavirus and measles within 1 minute, about the contact time. So how is it tested is actually in a lab using human coronavirus 229E. So this is a very common standards that has been used for antiviral, antibacterial products. So they will use this standard and test. Yeah. So there's two kinds to this mask. One is an antiviral surgical, what you use daily, and one is an N95 respirator plus, which is more recommended to use in a hospital setting. Yeah. So our mask is ASTM level 3 surgical mask. So this is the highest level in terms of the ASTM is about American Society of Testing and Materials. So this is the highest level of surgical mask that is. There's 5 key pillars what they look at: breathability, bacterial filtration efficiency, particle filtration efficiency, fluid resistance, and lastly, flammability. So this is the highest level of standards. Okay, move on. Okay, so question that you might have, right? What's so special about our mask? Most of the surgical masks in what you buy off the shelf is usually a 3-layer construct. Ours is 4-layer. And what's so special is really about the patented technology. It's called Virex. It's actually a virucidal layer. It's a second layer. So usually for a normal surgical mask, right, the first layer usually is hydrophobic, which is fluid resistance. But instead, our mask, the first layer is actually hydrophilic. What it does is when a infected droplets carrying virus, right, touches the first layer of the surface, the content, citric acid at the first layer, will absorb the virus droplet in, and then denature the surface. And we goes to the second layer, which is a virucidal layer, right? It contains copper and zinc properties. So this is a trademark properties. So it will kill off the virus. Yeah. So you can see. I will not go through in details, but basically how it acts is like mimicking a living host cells. So that when the virus got absorbed, right, it actually kills off virus. the mask that most people are wearing now is actually doesn't kill the virus. It's just block off, keep the droplet at the surface. Yeah, I'll explain why that is a cause of concern later in my slides. Then if you see, well, when they do a comparison, right, with ordinary mask, usually a hydrophobic layer, right, the fluid particle will tend to stay on the surface. Whereas for our mask, right, it will get weak and absorbed in by the first layer, and it go into the second layer, and the virus will then get killed off. Okay, so of course, coronavirus, of course, COVID, right, is all the hot topic, right, Omicron and all. But other than that, right, there's actually a lot of other viruses out there, right? You have the seasonal flu, H1N1, H3N2, the pandemic flu, other viruses, measles. Yeah. So in an independent lab test, we want to test how efficient, this antiviral layer can last to continue to have the fallout reduction. So they did 8 hours the challenge. So after 8 hours, right, it's still efficient and it still cure virus upon contact. So with regards to the comfort level and all, we have been supplying this mask for a while. People try it, test it, and it's feel comfortable. So importance of having a good mask, right? How you wear it, how it covers your face, all these are very important. If you want a mask that really can able to get good coverage, right? That's something that when consumer choose their product, they should really look at this, the fitting itself. Yeah. Okay, so in this page, right, is some of the different pack and sizing. So with GoldenConcepts, right, we have listed the 5-piece pack and a 24-piece pack. Okay, these are the different certification. These are all the technical specs that we have for our mask. Okay, so a bit more about do's and don'ts about masks, right? I think this is really important to highlight again about wearing your mask. So selecting mask and wearing mask is two different things. So if you select a good mask, but when you wear it, right, it's important. On the left, it is very common when we go outside, we see people, we see our friends and families, you'll see how they wear their mask. When they speak, they'll put out the mask, they don't wear properly, nose is exposed, chin is exposed. Then after that, if they want to, shout across the room, they'll pull out even more, and you want to eat something. And some are too loose, some are too tight, and some even, take out very commonly, you take out the mask and you hang it around your arm. So these are really the steps that you do not want to use your mask this way. Okay, in fact, to have a proper, donning of mask, right? First, of course, you have to follow good hand hygiene. Wash your hand, clean or sanitize your hand. After that, check your mask for any, holes and all. Then after that, you wear it properly, press it, fit onto your mouth. And then other than that, you do not, what important thing, right, is point number 6, avoid touching your mask. What a lot of people do is actually, they like to touch the surface of the mask because they keep adjusting, because it doesn't fit well. They keep adjusting and touching the surface. And you remember what I said earlier, actually a surgical mask, right, when they have a virus particle on the surface, right, it actually stays there. So when you touch your mask, and then you tend to adjust your hair, touch your eyes, touch other part of body, shake hand, touch your family, clean things, carry things. So these are all a mode of transmission. So so this is why respiratory mask in the point where when there's a virus droplet on the surface, right, it gets weakened and killed, so that you reduce the odds of transmissibility. Yeah. So of course, lastly, when you remove your mask, right, change your mask daily, or when it's soiled and it's wet, change it and discard the mask immediately. Yeah. Okay. Let me go to the next slide. So we have started our partnership with GoldenConcepts. The products that Romain had mentioned, surface cleaning, gamma wipes, universal wipes, what Michael has mentioned, the Arneos gel, and of course the antiviral mask. So during this season, when things are opening up, VTL, people may go travel, and and it's festive season. Places are very busy. You go to market, you go to town, there will be gatherings. So it's important to protect yourself with really, really good infection control products. So our mask, right, it's good for gifting as well. You can come individually packed. Yeah, so you can consider, buy for families and friends. And recently we even launched a child size mask. So you have a child, so you can also get the child size mask as well. Yep. So that's all for my presentation. Yeah, thank you very much. We'll go to the Q&A session.
Thanks, Gary. Yeah, I think you guys did the three speakers today really did a good coverage of all the topics, starting from the surface cleaning to the hand hygiene, and eventually also for your personal protection, like for the face mask. And I think one of the good takeaways from what Kerry shared about the mask being having a completely different design actually. Instead of just being waterproof, just actually being being able to kill the virus. That's very interesting, Sherry, because we were wondering what's the difference, right? There's so many different masks all around. And so maybe I just had a question in terms of for maybe any of the three speakers, you could jump in on this. But my question would be like, in terms of the frequency of how often should you be performing this like infection control measures? Maybe you can give a suggestion for people who are caring for their elderly loved ones who may be maybe more prone or more at risk of getting the viruses or any diseases and bacteria.
So let me reply to your question when it comes to surface cleaning, but I think it will apply also, of course, to hand hygiene, because as you could understand, I mean, when we talk about infection prevention, it's a total approach. So you will never consider surface cleaning separately from hand hygiene or separately from PPE. So it's really a triangle. So that's the first thing. In home care, I think what is very important is all related to if a patient in which stays at home receive the visit of a caregiver or relatives, he will definitely need to actually perform surface cleaning to protect them from cross-contamination. The home caregiver will definitely needs to clean and disinfect all the devices, the equipment he will bring to home. So it really depends on the frequency of visits, really. If there's no visits, as a standard practice, you will perform surface cleaning once a day. But if you have multiple visits along the day, definitely it would be recommended to perform it before people visiting home as a precaution.
I see.
Yeah, Vanessa, may I add on, right?
Sure.
Especially home care, when some of them might need assistive devices, like wheelchair, scooter, and they tends to come home with this. So, usually you have been outside for a long time and you go back home.
Yeah.
So, yeah, I think it's important, right? Like what Roman said, it depends on the frequency, is there any visitation? So if there is, right, so it's better to start cleaning down, disinfecting after, every such event will be recommended. In acute setting is after every patient, after every touch, they will always do their hand hygiene. If they go like patient to patient, that's what they tend to do. So in home care it is less, but then when there's any external, interactions, right, we should try to do that.
And Vanessa, let me add also
Yeah.
about surface
Sure.
cleaning, because even though the patient doesn't have a lot of visitation, you still need to perform a regular surface cleaning, because what you need to understand is that surface over time will get dirty, and the more they get dirty, the more it's going to be difficult to clean them in the long run. So it's a regular exercise to perform surface cleaning to maintain a good level of hygiene over time. Because the problem that if a surface is not clean over time, you will have what we call biofilm, which means basically the dirt will become basically a substrate for bacteria or viruses to grow. And so once you have this kind of layer on the surface over time, then it gets even more difficult to clean the device. So it's really to perform a regular hygiene to maintain a good state of the equipment or the wheelchair or any equipment you're going to use.
Yeah, that makes sense. So it's really about the regular maintenance rather than having a deep clean only once in a while.
Exactly,
Yeah.
exactly.
Hoping for the best.
And deep clean is not effective, because if you, usually people would think, oh, I need a deep clean because I see it's visually dirty. It's already too
Mhm.
late, because it's especially with the equipment, sometimes it's not very easy to clean. So you can get dirt inside in the cracks, and very difficult to remove then the dirt. So if you perform this on regular basis, you protect really the device from getting dirty over time.
Mm, okay. And for Michael, what about in terms of hand hygiene? Like, is it something that every individual, I mean, in a home care setting, would it be also the elderly person themselves who have to do the hand hygiene, or is it mainly the caregivers? Maybe you could share with us about that.
Sure. I think earlier Roman pointed out a very good point that when we talk about surface disinfection, right? Not only are we talking about the areas that near the patient or the resident, we are also talk about being responsible as a visitor to keep our personal accessories clean, right? So the same, I think, principle applies here. We recommend the residents, the old elderly, and also caregiver to practice good hand hygiene. At the same time, for visitors, we also strongly recommend them that they rub their hands, disinfect their hands before they enter the room, the home, and before, if possible, before have contact. I mean, touching the senior, right? Skin to skin contact. Good to also practice hand hygiene. So in this way, we can really minimize risk of infection through direct contact transmission, right? Not only protect the folks, but also protect ourselves.
Mm. So when, let's say, when visiting let's say a elderly relative, right? When you go to their home, for example, would you start off with washing your hands with soap first and then going for the hand rub, or just directly using the hand rub?
I think, well, I think hand rub is really supplementary, right? And on day to day, we still do a lot of hand wash, which is absolutely fine, right? I would say that the washing your hands after you enter the old folks' home is something that I would do personally. Of course, for that, before I would still regularly practice hand hygiene using hand hygiene products, just to keep my hands microbiologically clean.
Yeah. Okay. Yeah, I think it's particularly necessary for us because you could be visiting or living with vulnerable people, like vulnerable relatives who may be really much more susceptible to the bacteria and viruses. The other thing that I think, Kelly, you did mention briefly was that as the VTL starts to open up and there's more people starting to go on their travels and all that, what would you recommend for somebody who is going to plan a trip? What would be the best way? I heard that the flights are quite full now, so we can give some tips on that.
I think the last thing you want, right, when you go travel, after waiting for so long, is to fall sick, overseas, right? So I mean, definitely, try to pack, good infection control products, right? Bring hand gel, disinfectant wipes, a good mask, practice. You have good products, but yet you also need to have the right technique, like how to hand wash properly, how to use the hand rub properly, like what Michael has shared earlier. So I think these are the consideration lah. Just be prepared for it, and definitely we are coming out with a very nice. I think next month, right, we're coming out with a very nice travel pack where we'll put all 3 products together in a travel pack, and you go for the 5 days, 1 week, you just pick up a pack from GoldenConcepts, and hopefully it helps to keep you healthy, protect. But definitely the products are all medical products, and protecting you is nice.
Yeah, I think that's a good emphasis, that the products that we are talking about today, and also the people who are sharing are really from a medical perspective. It's not so much just a lifestyle kind of mask, but it's really from a medical grade infection control perspective. So I think that's why we really also wanted to bring the experts here to share on this topic. So yeah, I think we can wrap up the session. For those of you, because I don't see any questions in the chat, so I think everybody's absorbing it well.
I have a question, Vanessa.
Yes, Michael, go ahead.
Okay, for Roman, I think earlier Carrie talked about assistive accessories like working frame, working stick, and also a big frame, for example, for elderly, right? So Roman, from a home care perspective, would you recommend, what kind of frequency would you recommend for for either the elderly or the home care giver to treat those surfaces?
So again, it really depends on the visitation, but basically, as a general recommendation, is basically once a day. It's a daily cleaning and disinfection of high touch surfaces. So high touch surfaces are basically surfaces that are touched not only by the patients, but also by the people which are visiting him. So this needs to be done at least once daily.
Okay.
Okay.
So I guess the thing about surface cleaning is don't be lazy. And
Vanessa, I just remember one thing.
Yes.
One very important equipment, right, that we always have with us.
Oh yes.
Is handphone. I guess this is something that everyone please please be reminded every time you tends to put it on the table and put it close to our ear, and it's something also one of the high mode of transmissibility. Yeah, we remember
That's
to
true.
clean your wipe disinfect your phone as well. Clean properly.
Yeah. So if it's good enough for your skin, it's good enough for your iPhone. So don't worry about that.
Yeah, definitely. Yeah.
Gentle on the skin.
Our wipes is for medical devices, so definitely is compatible with your phone.
Yeah, definitely meets the standards. Yeah. So I think so just a quick summary of what we've managed to cover today. We started off with Romain just really giving us the breakdown of how we could go about with a proper surface cleaning, the proper method to go about it, the S shape that we learned. We'll do some of the main points. We'll cover them in a summary as well. So do look out for that after the talk. And then also we went on to talk about the right method for and the benefits of using disinfectant versus just using a detergent. I thought that's very interesting. What's the difference between soap and actual disinfectant? So and then after we have Michael, who shared with us about the hand rub, the 7 steps in 30 seconds. I think a lot of us, to be honest, have gotten a bit lazy as the pandemic continues and it extends a bit longer than we expected. But I think it's a good reminder for us, especially when we are going to meet with our relatives or people who tend to be a bit more vulnerable. We have to be particularly careful and really not lazy about it. And also from our final speaker, Kiawei, who was sharing about really what's the difference between normal 3-ply mask, which I think a lot of it is available, and also like the RespoCare masks, which are antiviral in their surface, and how we can really use that as an extra layer of protection when we are out and about, and even when we are traveling as the VTL start to open up. So I wanted to really just take the chance to thank all 3 speakers for taking the time to really share with us your expertise and experience about your passion for infection control. I think a lot of us may come from just a non-medical background, so to us it looks pretty much the same. We may not really understand, but so thank you so much for really showing us what's it like, in a hospital setting, in a very strict, I would say, infection control setting, and the habits that we could take away from that as we go about our home care day to day. So thanks so much to Romain, Michael, and Kiawei. And also thank you so much for our participants. We will be uploading this recording as well, and also coming up with a summary of the key points that were highlighted today. So do stay tuned for that. That will be probably sent within the next few days in our post-event email. And yeah, I think we will just do a quick share of our final slide. which will be a quick link to our COVID-19 kit that Kelly was kindly shared just now on page. Yeah, so that kit will be pretty much contains the 3 different types of products that we have covered today. If you're looking for something for your loved ones, in terms of proper good infection control, really just check it out. And for those of you who haven't joined us yet on our WhatsApp broadcast list, you can just do a quick scan of the QR code on the right side. This will be a way for us to reach out to you quite easily via WhatsApp when we have any upcoming events. You can just we'll usually blast it out, and you can just sign up from your handphone, which is, I think, hopefully you've disinfected it well also after this sharing. Yeah, and so thanks everyone for joining us on a Monday. I know it's difficult on the start of the week, but we look forward to seeing you guys next year when we host our following events. And till then, just be safe and happy holidays. See you all.
Bye-bye. Thank you.
Bye. Thanks. Thanks, Romain. Thanks.
Take care. Bye.
Thanks, Michael.
Bye-bye.
Take care.
Take care.
Bye. Bye, Kerry. Thanks, everyone.